Okay, well, good evening, everyone. On behalf of the Alumni Association Board of Governors, we would like to welcome you to our Careers, Life, and Yale Thursday night show. Tonight's topic is the psychological impact of COVID-19, which is dealing with coping strategies to combat stress. This is part of our ongoing life and personal growth series. My name is Andrew Burgee, Yale class of college 1987, and I'll be serving as your moderator this evening. As a brief overview of tonight's presentation, Dr. Fermetta will give an overview of tonight's presentation, which will be followed by a discussion of the material presented in a series of breakout rooms. This will then be followed by a 1 to 2 word phrase report out of lessons learned and further Q&A. Now it is my great pleasure to introduce our guest speaker, Dr. Cecilia Fermetta. Dr. Fermetta is a licensed clinical psychologist, assistant professor at Yale University School of Medicine. She's a core faculty member within the psychology section at the Child Study Center. She's been in the mental health field for over 20 years and has extensive therapy, teaching, program development, and public policy experience. Most recently, she was featured on NBC Nightly News on a segment on helping parents identify depression in children during the COVID pandemic. Without any further ado, welcome again, Dr. Fermetta.
Thank you so much, Andrew. And thank you so much, everyone, for this invitation. It's a pleasure to be here with you this evening, and I look forward to getting to know you a little bit more. I do have a PowerPoint that I am going to share with you. I also want to let you know that, as you will see on the chat, there is a emotional wellness zip drive. It's a toolkit, and it's my gift to you in terms of some resources that I hope will be useful to you from this discussion this evening. My goal of this discussion is to provide you with didactic information, and I'll keep that portion brief, but to engage you in a conversation, which is why we will be doing the breakout rooms as we progress this evening in terms of thinking about coping strategies during our pandemic. So with that, let me share my screen. So again, I'm going to be focusing on the psychological impact of COVID-19 and coping strategies to combat stress. So first and foremost, as we know, and I'm going to keep it brief, we do not need the CDC to let us know that the pandemic can be quite stressful. COVID-19 has been stressful to all of us in many, many different ways. It's led to fear and anxiety about a novice disease, which none of us knew much about, and that we're all learning about together. We know that fear and anxiety can be overwhelming, and it can cause strong emotions. And we've learned that with fear and anxiety during COVID, that it really spans the lifespan. In other words, that adults are equally impacted as children. And we're going to talk a little bit more about that. We know also that through public action such as social distancing, that while it's been effective in terms of reduction of the spread of COVID-19, that it certainly has led to a myriad of challenges such as isolation, loneliness, and it can also lead to an increase in stress and anxiety. I certainly have seen it in my practice, as well as in some additional presentations that I've done. We know that actions are necessary to reduce the spread of COVID-19. So again, tonight we're really going to focus on, building a toolkit together in terms of really thinking through. We know that that the pandemic has been stressful. How do we cope? What are some healthy ways that you have actually found within your community, within your family, that you could perhaps share with your colleagues in order to bring all of us together. So I promise that I will not show too many graphs. I have 2 graphs, and I'm going to keep it really simple. But I thought that this was very effective, and that is, this actually is changes in mental stress among adults in the U.S. from April 2020 to January 2021. So April 2020 being really at the start of when we all were scrambling and learning about what COVID-19 was and the restrictions and so forth. And so one of the things that I really just want to call attention to here, and the sources here in the bottom, is the lighter blue portions of the graph. And as you can see here from April 2020, you see actually the lighter blue represents more mental stress that individuals have experienced. And there has been a kind of gradual decline in terms of the more mental stress throughout the course of these months. However, if we look at the next, the darker blue, the same level of mental stress. So these are individuals who are reporting no changes in their level of mental stress. One of the things, obviously, that we'll notice is that, from my perspective, this really identifies chronic and prolonged stress, which we know actually can impact a person's physical health and emotional well-being. So this has been consistent, and as we can see, it hasn't dropped too much. So we know that worry, stress, and anxiety and other emotional responses are to be expected or are expected during times of any instability. If we think about, different phases of our life that we have endured, and for those already suffering from mental health ailments, the extra pressures of COVID, and that is shifting, environments, trying, having lots of uncertainty in terms of what's going to happen at work and so forth, certainly serves to exacerbate mental health conditions. An additional challenge for those experiencing emotional distress during the pandemic is that social distancing regulations make it more difficult to access appropriate mental health services, right? So people are feeling more isolated. I would say that luckily I'm a strength-based therapist, and the good news with that is that telehealth, I think, has done and has been a nice access point for individuals who actually otherwise would not have access to mental health services and so forth. So I certainly have been quite busy and have seen individuals, but there is this need to see individuals in person, which at times obviously are currently is something that, at least from my perspective, that I cannot do. So there's stress during infectious disease outbreaks, and some of it can cause and fear and worry, as we talked about our own health. Really thinking about the health of our loved ones. Do we take a vacation? Do we not? What does that look like? Does everyone get tested? What is Thanksgiving? What did Thanksgiving look like for you? Thinking about job stability in terms of what may be going on at work. Also, loss of support services you rely on, whether that's a particular group that you typically met with face to face, on a weekly basis and so forth. So we know that certainly is an issue. We also know that stress also causes changes in sleep and eating patterns, obviously. So certainly some individuals really struggle with this, and I'm going to show you another graph that helps delineate this a bit more. And changes in eating patterns. People are either on the go or skipping meals or eating in a different manner than they typically are used to. Again, difficulty sleeping and other activities of daily functioning, and difficulty concentrating as well. Worsening chronic health problems. Individuals may not have the capacity from concentration, following up with some chronic health issues. So certainly that's something that we are seeing as well. Worsening mental health conditions because of not being able to get the preventative care and catching things sooner than later is another issue. And the one that I have actually now have been seeing much more is an increase in substances as a way of escape, as a way of coping as well. So certainly there has been an increase in this area in our population. And if we look at some of, just briefly, this graph here shows an increase in prescription medications. It follows 31.5 million commercially insured individuals during our pandemic. As you can see here, we have seen extensive increases in psychotropic medications in terms of anti-anxiety, antidepressants, and anti-insomnia medications as well. And it's important for us to really think about kind of the different groups and how different groups are impacted or have been impacted by COVID. So we do know that individuals of color, Black, Brown communities, women, individuals with lower income with lower incomes have been more at risk of developing mental health issues as a result of the pandemic. In general, many Americans are experiencing increase, and we've seen an uptick in mental health problems. The groups that are reporting greater sadness, stress, and anxiety are, if we compare from a gender perspective, men and women have a slightly higher percentage of stress related to COVID. And if we look at different demographics, we have Latino and Black populations showing a higher rate of anxiety, fear, and sadness as compared to a white population. And again, we see some of the inequities here in terms of lower income individuals having higher levels of stress. And we can certainly go on and think together about what causes this, but certainly some of the challenges, the financial challenges that may be experienced by individuals with lower income is one of the determinants of this. We've also, we know that individuals who are working directly with individuals who are impacted by COVID, first responders, for example, a group that I've worked with, certainly under a tremendous amount of psychological, emotional, and physical stress, right? One of the first things that I often hear is it's so hard for me to shut it off, and worrying, the chronic worry of bringing something home to a family member, and it's constant. So we know that during a response, we need to understand and identify that burnout and secondary traumatic stress is really important to keep in mind for first responders. So a lot of them actually experience vicarious traumatization, is another way of talking about secondary trauma. Compassion fatigue is another way of talking about secondary trauma, where they're seeing individuals, who are suffering physically, and they're seeing this consistently, and it's impacting them. So one way of coping with that is, if possible, is limiting alone time and trying to work in teams. And certainly some hospitals have adapted, some of their strategies in terms of supporting their faculty, their personnel to do that. Responders experience stress during a crisis, of course, and when the stress builds up, it can cause, again, this feeling of, complete exhaustion and feeling overwhelmed as well. So I just want to kind of, highlight some of this without talking too much to you here. And then I just now want to segue into talking a little bit about some of the coping strategies. So now we know what the problems are. We've known what the problems are. We know what it looks like. We know that depression is real, sadness, anxiety, fear, and we can go on and on. But what do we do about this? And how do we cope um, with some of this? So these are some ideas, and I'm going to actually, encourage you to think about your own ideas of how you cope with stress. So taking breaks, for example, from watching TV, one of the first things, they say to me, well, what should I do? Take a break from watching TV. We've all been there. We've seen CNN and MSNBC and the recycling of the stories over and over again, which can get overwhelming. Same as listening to news stories. Also, social media at times really. Some individuals may actually place some information that may be overwhelming. So certainly that's something that is another recommendation to really minimize the use or have some strategies or a routine where you're actually, I have some my patients, for example, not look at social media during a certain time of the evening as a way to really kind of decrease some of the stress. Um, Taking deep breaths, I think, just general physical exercise is very important, stretching and so forth. Um, we all know the basics. I won't spend too much time on this. You can read this. Eating healthy, well-balanced meals, really pre-planning as much as we can. Doing that is important. We spoke of exercising, sleep, having the 68 hours a night of sleep is very, very important. Avoiding excessive substance use of any kind. Continue with routine preventative measures. So and this is, I think, really important. I was very struck by this because I think a lot of individuals are so focused on really combating kind of the, COVID that when it comes to our screening, whether it's mammograms and so forth, that it's kind of fallen to the wayside. And people are actually not doing this because it's not telehealth, going to the doctor's office and actually do this. But it is very important to keep that routine. Routine is very, very important. And of course, the vaccination. It's also important to make time just to unwind. And it's very foundational to just very good emotional health. Try to do some activities you enjoy, whatever that is. Insert right now whatever activity that is for you. Connecting with others, I think, is really important. So really talking with people you trust about your concerns, how you're feeling, instead of keeping it in, is something that can be a release for you if that's really something that is helpful. Connecting with your community, whatever that is. I know this is a group, this is a community, which is really important to keep in mind. Um, and and if that's not, if it's not possible to connect in person, then really connecting online and so forth. And I have families who actually will do like a Zoom call, like a Zoom Sunday night call, so that they can see each other as if they are unable to see each other and so forth. Sorry about that. All right, so that's what I have. I want to now segue into the next part, and this is going to be the largest part of tonight's talk, and this is what I would like to spend most of our time on. And if you would like to take a picture of the slide, I think that would be a really good idea. And so what we're going to do now is I'm going to talk you through what the next 15 minutes are going to look like. So I've developed some discussion questions that you will will have some discussion groups. So you're going to be going into smaller groups. I do want to make sure that I note that those groups are not going to be recorded. And I think that's important to note because, we are talking about emotional wellness. And it's important for me as a psychologist to just note that you want to share whatever you feel comfortable with. And if you feel comfortable sharing, that's great. If you don't, that's great too. But that it will not be recorded. We do encourage you to have a conversation. I'm going to encourage you to have at least one person lead the discussion questions. Take a picture of it now, so that you have a sense of what they are. So let me just review them really quickly. What are some things that have been helpful in dealing with pandemic challenges? Number 2, are there specific strategies that are more or less helpful to you? And I want you to really think in number 2 about your role as a parent, as a worker, as a partner, as a friend, as a grandchild, as whatever it is. Are there strategies that you're like, oh, this is really helpful. I would recommend this to anyone, or this is something that was not helpful. And just really thinking about that. And number 3, and this is a call to action for you. And that is, I actually am going to encourage you to commit to one thing to do for yourself in terms of self-care this next month, to really combat some of the stress that we all experience as a result of COVID. And so in the interest of time, what I thought would be helpful, I'm going to go on to this particular slide, and I'm going to encourage you to also take a picture of this. I'm not sure if you're familiar with this particular website. It's PollEv or polleverywhere.com. And if you actually go to pollev.com/C for Meta, which is my name, you will be able to actually just put in some responses. So I'm going to go back here, based on whatever you are discussing, what I would encourage you to do in your breakout rooms, in your small groups, is to then actually, and I put one in here as a sample, for question, what are some things that have been helpful in dealing with pandemic challenges? I put in sleep. Sleeping is really important, so you can do some shorthand here. But it's a nice way for us to actually create our wellness toolkit, and to have a discussion of what this was like. So you can also, as you can see here, you can go to pollev.com. You can also go to text 37607 and then C for Meta. And you can also, it'll tell you to actually put in whatever response you would like. Okay. Is that clear? Because this is, oh, fantastic. All right. So we're seeing it live. You guys are great. FaceTime, family. Yes. Friends. Being regular. Absolutely. This is pets. Oh, I should tell you, you may hear a pet here, and this is fantastic. This is what we want to do. So let's build our wellness toolkit. Let's have this discussion. Let's keep this going. Chocolate, whoever wrote chocolate, fantastic. I'm with you. Spirituality, God, community, fantastic. Exercise, friend, faith, fantastic. Let's keep it going. And you can see how we're building this together. Pancakes, fantastic. Candor, absolutely. Community, music, absolutely. Okay, fantastic. All right, so what I'd like to do, you can continue to do this in the groups, and let's see where we are now. It's just kind of, this is fantastic. I'm not going to stop this. This is great. So we have exercise, community, partner, God, music, family, wildlife, one of my favorites. Meetings, cooking shows for those who cannot cook. Zoom meetings, fantastic. Testimonies, cleaning, these are fantastic. Connection, webcams, fantastic, great. All right, so I'm gonna encourage you to continue to do this. You've got it, and we're gonna see this continue to kind of shape as we build this together. I'm going to come back here, and now we're going to have you join the groups. Okay, so I just want to do a quick check-in. I'll start very generally. What was that like? How was that for folks? Thumbs up. I see some thumbs up. That's a good thing. Fantastic. I thought it would be helpful just to have the smaller breakout groups so that individuals so that you can connect with your peer, with your colleagues and really talk through some of these pieces. So I want to actually go to the next slide because I loved it so much, and thank you so much for helping us build our wellness toolkit. And I'm just wondering, I can go in order by group, in the interest of time, I'm going to keep it as simple as possible. But group 1, did you want to share anything? What was it like, your experience? There's 5 groups.
So there were just 3 of us in group number 1, and 1 joining us remotely only by text. So it was an intimate conversation. I don't know if that was the same for other groups, but we were able to exchange some ideas and hear about some good recipes. And so it was all good.
Fantastic. Great summary, Cynthia. Anybody else want to add to that? I see there's something in the chat. So group 2. So, and I'm also reading, I don't know if somebody can read what people are sharing. Also, you can share in the chat. It was really great. I'm the text person, and I still have felt very included and connected. Fantastic. So thanks to my group mates. Fantastic.
I think group 2, just a quick thing, the importance of managing your time. Everything's not that urgent, turning off alarms and things that are reminding you of things that kind of keep you in a sort of frenetic pace. So that, turning off alarms and things like that are constantly reminding you of something that's immediate was good as far as having more control of your time. And sort of downloading off of news, like you were saying before, and media.
Absolutely. Great. Andrew, and you were in group 2, is that correct?
Yes.
Okay, great. Anyone else from group 2?
Yeah, so I was also in group 2. We definitely had some very candid conversations about some of the difficulties in our specific situations. One of our group mates actually mentioned that, they're going on sabbatical because, again, having tutored kids, that are at the middle school and high school level, it's been a little bit frustrating and somewhat, sad to see the effects of the pandemic on the education system. And, I myself actually, I tutor a stats class here at Yale, so I can definitely relate. So just taking necessary steps to add barriers for things that are frustrating, or, just give yourself a much needed break. That's also what we talked about.
Fantastic. Thanks, Mark, for sharing. Sounds like it was a great conversation. I like, the candid nature of the conversation, because I think that is so important to connect authentically. So that's great. Okay, we're going to move on unless there's others from group 2. And again, you can also put any remarks on the chat. Group 3.
I'm not sure if we're group 3 or not, but I'll just jump in here.
Fantastic.
I've taken up a new hobby of wooden puzzles, which has been like a meditation and a wonderful, very calming exercise that has nothing to do with anything, but very, very peaceful. That and outside walks with friends. It's been lovely and great way to combine exercise, fresh air, and social time.
Fantastic. Thank you so much for sharing.
Sure.
Those are great activities to share. Others? Group 3? How about group 4?
Group 4 was interesting, similar ideas that we heard, but there's 2 that at least stood out that I remember. Was one member was talking about the Laura Santos's happiness course. She took it, and she
the
was
most
similar,
popular course at Yale.
Yeah, but it was all, what was interesting is we both had the similar story. Like, I haven't taken it yet, but I said, oh yeah, I downloaded that course, years ago before the pandemic. I just never had time. She said, I did the same thing, but this time now with the pandemic and with employment changing, situation changing, she did have time, and she found it really worthwhile, which was great. And then another person, this was really interesting, was someone who had just retired from tech, went into art. And what I found really interesting was she, dove in and she did it. But what she realizes that there was a need after doing it very intently, is like sort of the need for balance. And I can see that actually in a lot of things of myself and other people, where, yeah, you do get really involved in like some type of hobby or something new. And then you realize it starts to take over your life too. So you have to watch out about that.
That's a great point. Absolutely.
So anyone else in group 4, I hope I didn't, say anything inaccurate.
No, you were very accurate, especially since you were quoting me about the Laurie Santos's class. Just to add to that, based on that, I do something every day, and that is to think of something I'm grateful for. And that is part of the course. And I think it's a good coping mechanism, not just for COVID, but for anything pre and post COVID. And it is really a key to happiness. And at the very least, you can say, I haven't died from COVID, And I think the other thing I would mention that a few of us, someone said, a few of us agreed with, was that don't be afraid of change. And just because this is your opportunity to explore things, and, maybe you're retired or lost your employment, whatever, you can, now's your time to sit back and not be afraid of change.
Christine, beautifully said. I love the resiliency piece that you talked about in terms of being grateful for something. I think that's really important, and the need, not being afraid of change, because that is constant. I think that's fantastic. Thank you. Okay, so, and then last but not least, group 5.
So following on what Christine said, we spent a fair amount of time talking about, I don't want to say the positive side, but, in terms of how, our business schedules, or just our schedules in general, the things that we just automatically do in terms of just keeping pace, that now that that's been altered, it's given, people an opportunity to look at things differently, to, not just do something by virtue of habit.
Right.
We did have a mental health professional in the group who did, remind us that, this is the stress, especially for young people, is very real. But we talked about how, a lot of people seem to be dealing, that there's something in the air, that a lot of people are dealing with issues that don't seem to be in any way emerging directly from COVID, like, an accident or whatever. And our mental health professional pointed out that, because we may not necessarily have the normal things that we rely on in those circumstances, that it just seems to be looming larger. And then I can hand it over to Randall, because we also, we finished the discussion talking about what can be very depressing, or most stressful part of this is looking around and seeing that there's this tenor to this particular pandemic, as opposed to pandemics in the past or other crises where people pull together. It seems as if our separations and that, at this time that we feel ourselves more apart, or, well, as Randall puts it, I'll let Randall. Randall, what did you say about
well, for me,
your awakening?
All right. For me, probably, am I tuned in here?
You are, Randall. We can hear you loud and clear.
Okay. The probably what ended up being the biggest source of stress during this was what I felt was revealed to me that I was naive about, how many people are out there who probably don't seem to care about their neighbors or their community. And the way they process things like this is at a very self-interested level. I happen to have some connections to a rural community in Northern California, and the extent to which that we don't care about the public health protections, we don't care about the protocols, vaccinations are a hoax and everything, was very, very stressful and discouraging. And I would have to say for myself that I had never in my lifetime ever had the experience of looking out into the world around me and going, there are so many people out here who are really not on the same page. They do not care about the community and how the choices they make affect other people. And that was hard for me.
Right, that is tough. Randall, thank you for sharing that. And Stephanie, thank you so much for reporting out for your group as well. So I very much appreciate that. So I just want to pause for a moment and just, look at this slide once again. And thank you for doing this. I hope this was helpful to you. And, this is one of many conversations that I hope you will continue to have in forums like this one, or in your own personal lives and so forth. And I would encourage you to continue to have these important discussions. I do see that there's one chat here. Great discussion, very helpful. Thank you so much. Fantastic. I wanted to make sure I didn't talk too much at you, and which is why this part was really at the heart of everything that I wanted to do. I do just, as a therapist, want to just make sure that, for those that you may know, or, even for yourself, if you are experiencing an increase, uptick in some symptoms, as follows here on this list, that have lasted for more than 2 weeks, then, there are many different types of opportunities for assistance through telehealth that are easily accessible, and are obviously are an important part of helping you cope with stress as well. And again, I just want to say that we really don't need numbers or graphs to inform us that, we're all going through this very challenging time. And as a psychologist, I'm always trying to look at not just the challenges, but also look at resiliency factors and coping mechanisms. And so these are some of my kind of take-home messages that I'd like for you to think about. Number one, again, we have a new appreciation for time spent with family and friends, and I think that's really important. I certainly, do appreciate that, whether that's via Zoom, whether, being creative and so forth. I think that is important. Our environment is catching a break. I think that's really important. I saw someone wrote in wildlife. I happen to love birds, so I really, appreciate this, and have noticed that I have less miles on my car. So, this is all good. We've been really creative about self-care activities. We heard some of our colleagues sharing some of their self-care activities, and really thinking outside of the box and thinking about, what that would look like. So that's been very positive. And we are very grateful, I think, for the internet. This Zoom has brought us together tonight. Netflix, I'm appreciative for that as well, in terms of, shutting things off after a while and doing that for a little bit. And also shutting Zoom off, once in a while, as we all know. And many have taken this opportunity to strengthen connections, whether that's spiritually or in other ways as well. I think that's extraordinarily important to keep in mind. So I'm going to leave you with this, and that is to really think about, what is your silver lining in all of this? Because we're so problem focused. I really want to leave you with some solutions and very strength-based way of kind of thinking about, how you can actually, take control of some of these pieces as well. And just in terms of resources, I do, and I believe you will get this PowerPoint, but there are a number of different resources. These are more crisis lines, of course, as you can see here, but they're free of service. They're available 24/7, and all calls are confidential. And here is, one of my favorite things to do, one of my favorite games to play. If there's any questions, I'll take them now. I don't know how much time. Oh, it's 9:02. I don't have too many questions. I'm overtime here. So I will say this. Thank you. This is my contact information. If you want to take a picture of this, you're welcome to, give me a call. And I know it's 9:02, so I want to be respectful of your time. And thank you.
Thank you so much, Cecilia. I definitely appreciate you sharing your time and energy, and I think everybody got a lot out of it. I definitely appreciate the fact that we had a chance to speak with each other and really talk about one-to-one coping strategies, because if the importance, as I saw in the word art, friends was a big word on there, right? So the importance of that human connection is definitely key, and the fact that we're able to do that, like you said, even though we're so far away from each other, but technically through this venue, we were able to talk to each other and talk about things that are important to us. So I thank you so much for your time. I thank everybody in the audience for participating. I definitely appreciate it. Definitely enjoyable. And obviously the programming is wonderful. So next Thursday at 8:00, please join us again for more Careers Life in Yale, the Thursday night show, must see TV. And I definitely appreciate everyone's time once again.